Welcome to the Boehringer Academy Parasite webinar series. In today's session, we'll be discussing treacherous tapeworms. So we'll start this session by looking at the problems that tapeworms can cause, both in animals and in humans. We'll then look at the tapeworm life cycle, and we'll finish by looking at the advice we can give owners about how to control tapeworms in their pets. So, what's the big deal about tapeworms? Tapeworms are common intestinal parasites of cats and dogs. In fact, over 50% of cats in a recent study were shown to be infected with tapeworm. And many of these cats showed no sign of tapeworm infection, either when they were examined for segments on their fur or on fecal analysis. There are a number of different tapeworm species, and so we'll be looking at the most common tapeworm in the UK and Ireland in today's session. And these are Dipylidium caninum, Taenia species, and also Echinococcus granulosus. So the first tapeworm we'll look at is Dipylidium caninum, and this is the most widespread tapeworm in the UK. You'll also hear it called the flea tapeworm, and this is because fleas form an essential part of this tapeworm's life cycle. More on that later. Dipylidium caninum is rarely associated with clinical signs in dogs and cats, but some owners will notice the presence of tapeworm segments either in their pet's faeces or on the fur around their pet's bottom, and they look like small flattened grains of rice. Understandably, no owner likes to see these tapeworm segments on their pet. Dipylidium caninum is also a potentially zoonotic parasite, and although rare, humans can become infected if they accidentally eat an infected flea or part of a flea. So the next tapeworm we'll look at is Taenia, of which there are many different species. Like Dipylidium, Taenia tapeworms have low clinical significance in dogs and cats, but owners may see Taenia segments in their pet's faeces or on the fur around their bottom, just as we see with Dipylidium. And this can have a significant negative impact on the human-animal bond. Taenia tapeworms can also infect farm animals. So if a farm animal becomes infected, they develop cysts, and this can lead to considerable economic losses for farmers. Echinococcus granulosus is a tapeworm that's primarily associated with dogs, as it can't complete its life cycle in cats. In dogs, it generally results in no clinical signs. But the major concern is that it's a zoonotic tapeworm. It can cause serious disease in humans, with cysts forming in the liver, lungs, bone, heart, and central nervous system. But thankfully, it's rarely seen in humans, and in the UK, we see approximately 10 to 20 cases a year. As with Taenia, Echinococcus granulosus can also infect farm animals, where it causes hydatid cysts. And this can lead to offal condemnation and again losses for the farmer. The difference with Echinococcus granulosus compared to Taenia and Dipylidium is that it's only found in particular areas. So we see it mainly in mid Wales, Herefordshire and the Western Isles of Scotland. But it's now known that other areas are more affected than previously thought. And I also wanted to mention Echinococcus multilocularis. So this tapeworm isn't found in the UK, but it's an important tapeworm to be aware of for dogs and cats that are travelling abroad. This map from ESCAP shows the distribution of Echinococcus multilocularis in foxes across Europe. And this gives us a good idea about where the parasite's found in Europe, as foxes are the intermediate host for this tapeworm. Echinococcus multilocularis is a serious zoonotic disease causing severe disease in humans. It will it can cause a significant reduction in life expectancy in humans. So let's move on to the tapeworm life cycle. So tapeworms live in the intestines, and unlike roundworms, they have a flattened appearance. They have a head called a scolex, and then they have a series of rectangular shaped segments called proglottids, and it's these proglottids that contain the eggs. The proglottids detach from the end of the worm and then wiggle out of the pet's bottom, and this is what we see when we see the segments on the pet's fur. So once the proglottid has wiggled out of the cat or dog's bottom, the eggs are released into the environment, and they're then eaten by an intermediate host. Intermediate hosts are essential to the tapeworm life cycle, and they vary depending on the species of tapeworm. So common examples include fleas, rodents, and rabbits. And it's really important to understand which intermediate hosts are associated with which tapeworm, as a helpful way to prevent infection is to prevent exposure to the intermediate hosts. Once inside the intermediate host, the immature tapeworm develops and forms cysts within the tissues. The definitive host, i.e. the dog or cat, then becomes infected by eating these cysts. I mentioned earlier that humans can also become infected by certain tapeworms, and this happens either by accidentally eating an infective egg in the environment, or, as in the case with Dipylidium caninum, by eating or accidentally ingesting infected fleas or parts of fleas. So a bit more detail now on each of the tapeworm species. As I've already mentioned, the intermediate host for Dipylidium caninum is the flea, but lice can also act as an intermediate host as well. Cats are much more likely than dogs to ingest fleas because of their natural behaviours, such as hunting and also the fact that they groom a lot more than dogs do. So this means that they're much more likely than dogs to become infected with Dipylidium caninum. Once a cat or dog becomes infected, the adults can grow up to about 50 centimetres long, and they generally start to shed proglottids in their faeces within about 4 to 6 weeks. The intermediate hosts for Taenia tapeworms are rodents, rabbits, and ruminants. And again, because of the hunting behaviour of cats, we see an increasing risk. Cats are at an increased risk of becoming infected with Taenia compared to dogs. The risk in dogs is actually quite low unless they're eating an unprocessed raw diet, they're eating offal, or they're eating rodents. Once a cat or dog becomes infected with Taenia, it usually takes about 4 to 10 weeks for them to start shedding proglottids in their faeces. And Taenia tapeworms are the longest tapeworms that we're discussing today. They can grow up to a huge 5 metres long. The intermediate hosts for Echinococcus granulosus are mainly pigs and sheep. And therefore dogs that have access to pig or sheep carcasses that are living in endemic areas are going to be at the highest risk of becoming infected with Echinococcus granulosus. And Echinococcus granulosus is the smallest tapeworm that we're discussing today. It normally measures about 5 to 6 millimetres long. So, what advice can we give to owners about how to control tapeworms in their pet? Well, this varies depending on the tapeworm, and so we'll go through each tapeworm now in turn. We'll start with Dipylidium caninum. So as fleas are the intermediate host for Dipylidium caninum, the best way to prevent infection is to use a year-round flea treatment. And remember, this is especially important for cats because they're at increased risk of Dipylidium caninum because of the natural behaviours they show, like grooming and hunting. Cats and dogs that aren't treated regularly for fleas should be considered to be at an increased risk of becoming infected with Dipylidium. If a dog or a cat has an existing Dipylidium caninum infection, they should be treated with praziquantel as well as starting on a flea control programme. Moving on to taenia, we'll start by looking at cats. So if a cat has outdoor access and is a hunter, which is reasonably likely in any cat that spends a significant amount of time outside, or if they're fed a raw diet, then these cats should be treated regularly with praziquantel. The SCAP guidelines recommend treating these cats at least 4 times a year. However, 4 times a year will not prevent tapeworm segments being passed in the faeces. And if we want to minimise this, then monthly treatment with praziquantel would be necessary. Now moving on to taenia in dogs. Dogs are considered high risk of becoming infected with taenia if they have regular access to sheep carcasses or they eat an unprocessed raw diet. So if a dog is considered as a high-risk dog, then they should be wormed every month with either praziquantel or fenbendazole. Dogs that are considered low risk, such as ratters, should be wormed every 3 to 6 months. If a dog is fed a processed food and doesn't have access to sheep carcasses or areas where ruminants graze, and the pet is considered to be at no risk, then treatment may not be required. It's a good idea to mention to owners that they can help to reduce contamination of the environment with taenia eggs by always picking up their dog's faeces. And lastly, onto Echinococcus granulosus. For most dogs living in non-endemic areas and being fed on a commercial diet, the risk of becoming infected with this tapeworm is negligible. But if a dog lives in an endemic area and has access to sheep carcasses or eats an unprocessed raw diet, they should be treated monthly with praziquantel. If owners are travelling abroad to Europe, then don't forget to mention about Echinococcus multilocularis. If they're travelling to an endemic area, they should be treating their pets with praziquantel every month. And all dogs and cats should be treated with a compulsory tapeworm treatment before returning to the UK. So to summarise the treatment recommendations, for Dipylidium caninum, regular flea treatment will eliminate the risk of becoming infected with this parasite, and monthly treatment will minimise shedding. For taenia tapeworms, cats that hunt should be treated regularly, and high-risk dogs with access to raw sheep carcasses and dogs on a raw, unprocessed diet should be treated once a month. Low-risk dogs should be treated every 3 to 6 months. For Echinococcus granulosus, dogs in endemic areas for this parasite with access to sheep carcasses and dogs on a raw, unprocessed diet should be treated once a month. So to summarise, owners don't like to see tapeworm segments on their pet. And so if their pet does become infected, it can negatively affect the human-animal bond. It's also important to remember that some tapeworms are zoonotic and that cats are at higher risk of tapeworm infection than dogs because of their hunting and grooming behaviour. And finally, for dogs, the risk of infection can depend on the geographical location. I hope you enjoyed today's webinar on treacherous tapeworms. If you'd like any further information on parasites, then please go to the Bowringer Academy at www.bowringer-academy.co.uk.